Hi everyone, welcome back to my channel. For those that don't know me, my name is Chiruta. I'm a certified professional coach and licensed massage therapist here in Longmont, Colorado. And we are back in my studio. And today I'm going to show you how to work the hip flexors. They are so utterly important with people that have low back pain and people that have hip issues. And if you don't work the entire hip area, then you're really doing a disservice to your clients. And a lot of people avoid the area because they just don't know what to do. So if that is you, then stay tuned. I'm going to show you how to work the psoas and iliacus effortlessly each and every time. So it doesn't really matter if they have no underwear on or they're wearing pants or whatever. Psoas work is really easy and very necessary when somebody has low back pain and they don't know why, or they do know why and it's chronic, like they sit at a desk too much or they drive too much. Really, really important when anybody has some chronic low back issues that you work all quadrants of the low back. So, you've got your anterior hip, you've got your lateral hip, and you've got your posterior hip, and they're all related to your low back. I've really never seen a hip injury or an issue that doesn't have a low back component or a low back component that doesn't have a hip issue. So in order to be thorough, you really want to work everything. And one of the things that gets missed is this psoas hip flexor region. So I'm going to show you how to work it. So it doesn't matter if they're wearing underwear or not, or they're fully clothed. Working psoas is easy, and honestly, it's so invasive sometimes that it's actually better if they're clothed. Okay, so big drape, and we are just going to find the ASIS, which is right here. So this is your ASIS. You're going to go 2 inches, 1 inch, 1.5 inches in, just straight medial, and then about 1/2 inch to 1 inch inferior. Okay. Now you're not going to know what you're on, and the reason you're not going to know what you're on, go ahead and tip. The reason you're not going to know what you're on is because there's all the organs right here, right? So all of that has to fall away, and the only way for that to fall away is with time, okay? And so if you want to make sure you're on the psoas and the hip flexor muscles, what you can do is you can just take your hand on their knee and say, just go ahead and push me. Meet my resistance with your knee. Yep, and you're going to feel something pop up and relax. And that's how you're going to know you're in the right place. But again, you're just waiting and holding. And really the pressure, the direction of my pressure is down. So I'm going diagonally in and down. Okay. Now this can be really invasive for people, or they can become really tickly. Tickly can be a number of different causes, but one of the causes can be a defense mechanism, an automatic defense mechanism. So again, if you have rapport with somebody and they're feeling ticklish, all they have to do is just touch you. That's all they have to do, is just touch you somewhere. So I usually have their arm just kind of touch against my leg here. They just kind of touch. And I'm ASIS in about 1.5 inches, down about 1/2 inch, and my pressure is diagonal and back. And to make it a little more comfortable for them, I laterally rotate their hip a little bit and give them just a slight bend in their knee, and then you'll make sure that the bolster is under their knee. And I'm just waiting and holding. That's all I'm doing. I'm just sinking and waiting and holding. And what are you waiting for? You're waiting for a release. You're waiting for something to give a little bit. Now, sometimes people will let you in right away. I find that's pretty rare. Most of the time, It'll feel very cement-like, trampoline-like. If anybody has had any trauma with childbirth, any sexual trauma, any, difficult C-section, any abdominal surgeries, extreme weight loss or gain, bypass surgery in which they lost a lot of weight, they're going to have issues in this hip flexor. Now, remember, let's do a little anatomy review. Your psoas muscles are the only muscles on the front side that are going to attach to your lumbar spine. Remember, the origins are the bodies of the lumbar vertebra. And so always impacted, maybe not always, mostly impacted in all low back issues. They're certainly a part of the story. And so you would really be remiss if you don't work this area. Now you can always work the other side. You can always work this by crossing the table. So you can work this hip this way. Again, you're going to find the ASIS, which is here. I'm going to go in about an inch and down about a half an inch, and you can go back into the hip fossa. Okay? And this is going to help you get iliacus. And again, if you're not sure where you are, except remember, iliacus fills the entire hip fossa. And you're not going to spend, I don't know, if you're doing an entire hour because somebody has excruciating low back pain, you might spend 5 minutes here. But if you're just doing kind of a maintenance session and somebody deals with chronic low back pain, you're going to spend a minute or two here. But you don't go quickly and you don't force anything, and you just wait and sink and hold. And as her body releases, then you can let go. And then you're going to come out nice and slow. And this would be a nice time to kind of make nice, but they might be done. One way you can do that is just by a little gently shaking and rocking. So psoas muscles, super easy, really important to balance the hip. And that's all I got. Thanks for joining. See you on the next one.